Hello, I'm here today to help persuade people into a broader understanding of healthcare information and how it helps diminish the frequency of public crises. I'm going to explain what it is, why it's important, and some methods that we can use to help diminish it. The publichealthcollaborative.org explains two different versions. There's misinformation and disinformation. Misinformation is the spreading of partially inaccurate or misleading information. Disinformation is the spreading of false, intentional information. Anyone can spread information. And especially with the rise in social media, things can spread instantaneously. And it makes it hard for people to quickly have an understanding of what is correct and what is not. There is a lot of reasons that misinformation can impact the public. And Taylor and Francis, healthcommunication.com, speaks about how it reduces trust in not only healthcare professionals, but the healthcare industry in general. For example, ScienceDirect.com speaks about how the MMR vaccine, a lot of individuals think that it causes autism, when really it is a neurodevelopmental condition that is typically hereditary through our genes. The U.S. Department of Health and Human Services also gives an example. COVID-19, we are all very familiar with what that is, but it attributed to a lot of misinformation being spread and made it very difficult for us as a society and a healthcare industry to be able to get rid of the wrong information and tell people the right information. It led to a lot of decline in vaccines because people were too afraid to get the COVID-19 vaccine because, yes, it did have the virus in it because that's how they make vaccines, but it didn't give people COVID-19. If you already had it, you had it, and this is how they would help stop the spread of it. It also led to a lot of unproven treatments being done and a lot of individuals taking those treatments, thinking that that would help them when it may have worsened their symptoms and or their illnesses that they had at the time. It also led to a rejection of public health measures. For example, when everybody was supposed to be wearing masks, a lot of people did not want to wear them because they didn't think that it would help in stopping the spread of germs in general, but specifically COVID-19. When that was one of the big things that did help stop the spread. Also, misinformation impedes individuals' informed decision-making abilities. When you don't have the right information, you can't make the right decisions for yourself. You may be thinking that it's the right decision, and then in the end, you realize, oh my gosh, that was not it. I should not have done that. I should have researched more, done more, to know what was correct. The Natural Library of Medicine gives an example about how a lot of harmful treatments were started when COVID-19 came about. In general, there's a lot of harmful treatments out there that are not scientifically proven, and people take them anyways because they think that that's what's going to help them. And there's also a lot of rejections of care. People don't want to get treatments because they don't think that it's going to help them. And both of those situations can lead to a worsening disease and or virus or illness, not only being spread, but for those individuals in general. Misinformation is a big part of why people do not get the care and the proper treatment that they need. There are a lot of challenges, though, that come with trying to correct it. The University of Nebraska Medical Center talks about how a lot of people do not like authoritative standings, and they will not really listen to people that are trying to tell them what is right for them and what is wrong for them. And that can make it difficult for people to get the care that they need. It also talks about how there can be a lot of backfire when it comes to trying to get that correct information out there. You'll be telling people, oh, this is the misinformation that was spread, but this is the information that is correct and that people need. And what they're going to hear is, oh my gosh, people have been listening to this information for so long and I didn't know about it, so is this the information that I'm supposed to be knowing? When in general they're supposed to be hearing that that's not the right information. You need to be listening to this information. There are multiple methods that we can use, not only ourselves, but the healthcare industry, to help rid the misinformation online and in person. The publichealthcollaborative.com speaks about pre-bunking and debunking. So pre-bunking is a primitive measure that people can take that limits the misinformation being spread. It fills in the gaps of knowledge that people did not know or were unfamiliar with. It specifically sticks to the facts so people can understand that this is right and this is what is wrong. And it also breaks any kind of tactics that individuals can use in order to spread the misinformation. Debunking is the secondary measure to misinformation. It is the reactive approach to specific claims that are out there. There are 3 different reasons that we can, or methods that we can help edge along in order to get the misinformation corrected. There's cognitive, emotional, and behavioral. The Taylor and Francis healthcommunication.com, they speak about how cognitively you can debunk the feeling of threats that come from misinformation. A lot of people get set in stone what's in their mind and their beliefs and their opinions of information that's out there or been given to them. And in order to help debunk that information, it is easier to give them another idea, another opinion, and help them understand that other opinion. And public panic leads to public threats. So having the cognitive ability of a person to be able to go and research what is needed helps diminish that. The emotional aspect of debunking is to get on their level, explain what they are feeling, tell them, yes, I understand you're confused, yes, I understand you're scared, I understand what you're going through, and we get it, but the information that you have been given is false, and the information that you need is here, and they will present it to them. So then that way it kind of diminishes the fear and the threats that they would feel towards the information that is right. Behaviorally, people are going to act the way that they want to act. It's been going on for centuries. And changing that is really difficult. For example, when we had COVID-19, people didn't want to wear masks. They didn't want to stand 6 feet apart. They didn't want to stay home when they were sick. They didn't want to work online because a lot of things went online. So, in order for us to change it, we got to work around it. And that became a standard when COVID was around. It was either do these things or don't come out. For example, my uncle was in a group home and he ended up getting kicked out because they had to keep restarting the contamination of the 2-week period when somebody in there had COVID-19. And that led to a whole whirlwind. He moved from Florida to Colorado. But because of the standards that the government took in order to put in place for COVID-19, it caused a diminished threat to the public with the spread of that illness and virus. So now that we are all aware of what health misinformation is, and the methods that we can all use in order to help diminish it, we can all take a stand and helping ourselves and helping those that are unfamiliar with it to create a more stable healthcare industry and to be able to have more well-rounded healthcare decisions for not only ourselves but our loved ones. Thank you for coming today.